I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center in Long Island, New York. So today I got this young man, he's from the Northeast, and he's got gynecomastia. So he's got, pseudo-gynecomastia, whatever that means, and he's got gynecomastia. So gynecomastia is gland, or gynecomastia really is just if you're unhappy with your chest. Are you 14 years old? You got breast buds. Are you 65 years old and a little out of weight, shape, or in shape, and you got chest? That's gynecomastia. But there's two types of gynecomastia. There's gland and there's fat. And you've got both. He's got gland in there. He's very sensitive, so it's hard gland, and that's ground zero underneath the nipple. And he's got fat all around here. So my gynecomastia surgery is not just around here. It encompasses the wall back here, encompasses down here. I now encompass the upper abdomen, the shoulders, the deltoids, the midline here. I mean, he's going to get a great shape from here to here to here to here. I'm going to mark them, and you're going to see exactly what my roadmap, what my blueprint for this surgery will be, how I define the muscles. So go over here. The muscles we're talking about is the deltoids, the pecs, the pectoralis major muscle, the lats back here, the serratus anterior over here, and the rectus abdominis muscle here. But there's also finite things. There's the linea alba, there's the semilunar lines, there's the edge of the pec going to a negative space to the lats, the deltopectoral groove, the groove between the deltoid muscle and the pectoralis muscle. All shadows and lights and shadows and defining in positive space and negative space. It's the whole thing. But I got a surprise for you today. I'm going to do something called J plasma. It's helium plasma. It adds about another half hour onto the surgery, maybe less. I go through the same stealth incisions, which is here, here, and here. And the helium is a radio frequency device, and you'll see it. It's quite interesting. This is something that I probably will be adding to my repertoire of gynecomastia that helps to really tighten, helps to really shrink wrap, and helps to really lift and really tighten the skin to give people even better results, if that's possible, than I already give. So I'm excited to see this comment about the J plasma, the helium plasma, and let's do some markings. The midline, all right, under the breast there, little triangle right there, semilunar line right there. I think this guy's ticklish. We may have a problem. No problem. Deltopectoral groove right there. You all right?
Yeah, sure.
All right, let's see, the lats. The lats back there. I can see where I'm gonna go. Come up over here. The lats back there. See where I'm gonna go. Alrighty now, the pectoralis lateral inferior, inferior lateral. You're okay? Surgery by numbers.
Okay, so
All right. I'm just giving my empty this out. Good. Bring up this one. Are you all right?
Super ticklish.
are you?
He's
Yeah, what's going on over there?
I don't know.
I don't know. He goes,
I don't know what's going on. We pump you up.
To pump you up.
So I remarked them a little bit, so the deltopectoral grooves, the upper limit of my dissection, liposuction, because I want to maintain fullness there. Transition down to the lateral and inferior border of the pectoralis major muscle, semilunar line, linea alba in the middle. Scoop all of this out from the lateral aspect of the pecs to the lats. Get the six-pack, top six-pack. In a minute, these are the ports to protect from the Vaser energy. In a minute, I'm going to Vaser, then liposculpt, remove the glands. Then, as I said, I've got a surprise for you, J plasma, which is helium plasma, and that'll help amazingly, even better than before, tighten up the skin. So we're going to give it a few minutes to numb, him to relax for a minute. You all right? Give him a little Jack Daniels, and we'll get going. Okay? You want a little Jack? Like that. I see no reason why not to. Let's go in there and start melting this stuff. Yeah, I think you got some nice glands there, actually. Gotta work on this. So there's a deltopectoral groove going on here.
Groovy, baby.
Here we go. So now the Power X. We can suck you out. So this is a new technology that I'll be introducing to my patients, to my audience, called J-plasma. It's helium gas that's ignited by radio frequency that causes a little spark. This is one of the hand pieces. This is a shorter hand piece I'm going to be using. This is just kind of like a trial thing. I'm going to be using the sterile one in a minute on my patient. But yeah, bring the blade out a little bit. And so that's a little blade right there, but we're going to keep it in because we really don't have to do any cutting. So this is going to help tighten. So the helium, which is the lightest element of gas, will be sparked, heat, and actually further shrink wrap underneath the skin, which is amazing. You know, let the dermatologists do the external stuff that really is limited for the discomfort and the epidermis and stuff. I'm going to do the real skin tightening that's underneath the skin. He's already numbed. And liposuctions, we got, oh my goodness, 2 liters, 200 out, and some fibrous glands through my incisions. So now put it on that little metal, and that is helium plasma. That's there, and that will heat up the skin. Now do a couple of passes, add another half hour plus or minus to the procedure, and that is amazing. So let's do it inside the body. Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. So today I did a wonderful case of gynecomastia surgery. I did Vaser, Hi-Definition, PowerX, Liposculpture to carve, reveal, etch, sculpt, and contour his male chest. Through my incisions in the armpit, by the nipple, and one added over here. Get that? These are left open to drain. They're going to drain for the first day or two. I also removed the glands. These are the glands that we removed over here. They were mainly fibrofatty, so I really kind of whittled everything down to perfection with the Vaser. I got out 2 liters 200 right there. Do you see that? Yeah. On the ground, and etched his pectoralis major muscle, the deltopectoral grooves, you can kind of see this, the upper six-pack, the semilunar lines, the linea alba, the lateral and inferior aspect of the pectoralis major muscle, and absolutely the lats over here. Now, as you saw, I'm adding this on to my repertoire. I used J-plasma, which is helium plasma, right over here. Is this still functional, guys?
Yeah.
So this is helium plasma. This is the little blade. I keep the blade in because it's internal. But let me show you with the blade out. And you do metal. So there you go. Right like that. And that's helium plasma. Maybe the metal here is better.
It's covered when it's covered.
See that? There you go. Look at that. That is helium plasma. Let me show it now on Garrison's hand. And it's just a great apparatus. So this helium plasma, here's the helium tank over here. That's the tank where the helium gas goes out of. And as I push the button, it flows. And there's a electrical radio frequency spark that we'll hit that, and that helps to shrink wrap the skin. And I used that on this gentleman. We did multiple passes underneath the skin in it, and that'll help to shrink wrap this for such an awesome result. This is new technology that I'll be adding to my practice, so stay tuned. I'm not using drains on him because his glands were not that big. I'm leaving the little stealth incisions open to drain. But now make a muscle. There you go. Look at this Hercules chest. Look how great that is. And he's still quite swollen. This is going to drain over the next 24 hours, and he will look absolutely amazing. So, as Justin Timberlake says, get your sexy back. Get your sexy back. You have gynecomastia, you call me Dr. Lebowitz, where I go over and above, and now J Plasma. Just wait until you see the results that now I can obtain. So if you have gynecomastia concerns, call me Dr. Lebowitz, 631-424-0101, 631-424-0101. Thank you, and see you soon.
I'll let you with me if I misbehave.